Okay, come through, please come through. We've been expecting you. Okay, put the baby down, please. Can you on the bed? Just on here, on the bed, please. Okay. All right, I need some help. Can someone get the anaesthetist on call, please? I need a paediatric anaesthetist straight away. Okay, I need oxygen. I want 100% oxygen with a non-rebreathe mask, please. Okay. So, could you just tell me the story? Okay, I'm doing so. Can you just tell me the story whilst we're doing this?
Yeah, so how old? I spilled boiling tea. I just poured some tea and it went all over her tummy.
Yep.
Oh,
okay.
God.
Okay, can I get some monitoring as well, please? There's some monitoring as well. Okay, that's good. Okay.
She's in pain.
That's fine. Okay, that's fine. Can you just, I need you to keep really calm for me, okay? Can I get another nurse in here? I need someone to speak to the relative. Can I get another nurse in here, please? Thank you.
Let's do something quickly.
Okay, that's fine. So oxygen is on. That's fine. Okay, and you get some monitoring as well. That'd be great. Okay, fantastic. Good. So airway is maintained and stabilised at this moment in time.
Listen to the chest.
Yeah. Okay. Do you want to listen? Can you listen to the chest as well? Okay. Yeah, just stethoscope anywhere. And can I get a paediatric registrar on call as well? Can someone call the paediatric registrar? We're going to need a lot of help down here. Okay. So fine, you listen to the chest there. Airways expectant as well. Okay, can I get someone else to hold this baby's head as well, please? Just hold it in this position. That's fantastic. Good. Okay. So, so we've done. So I'm happy with the airway for now. The anaesthetist is on the way. The paediatric registrar is on the way as well. We need to have a look at these at the breathing of this child as well. So, can I ask what the saturations are at the moment? Saturations 90%. Okay, fine. And that oxygen is on all the way up.
Just spoke to paediatric anaesthetist. Yeah. They're currently stuck on the PICU.
They can't be stuck on PICU. They need to be here right now. We're struggling. They need to be here right now. And so this is a newborn baby and is almost arresting. Okay. Okay. Yeah. So let's get some access as well. So large bore cannula in there, please. That is fantastic. And we send some bloods off as well. Good. Okay. So on the bloods, if we can send off all the bloods for all the matches, cross match, and also if we can get a CBG as well, a capillary blood gas as well, that'll be very useful. Thank you. Okay. I'm just going to expose the child a little bit more. Are you happy in that position with the child? Okay, that's fine. Okay, so we're going to see where this burn goes. So the burn is sort of the anterior part of the chest. So it's 13, yeah, 13%.
Yep. And she's not been called at all since it's happened.
Okay.
There's been no first aid.
Do you know the
no first aid. Okay, fine. Okay. So can we? It's worth us calling the mum as well if we can call the mum. That'd be very useful. Okay.
Do we know
90% the last sats and on full 15 litres oxygen. So we need help down here. Okay, fine. So airway wise, I'm relatively happy with the airway. We can try and adjunct. Do we have a Goodell airway at all in our set?
Anaesthetic coach is on the way down right now.
Fantastic. Okay, great. So we're just going to put a Goodell airway in first, just to get us buy us some time.
Did you want also paediatric reg?
Paediatric reg as well. Yeah, Yeah. We need them all down here. Okay, that's fantastic. Okay, so that's fine. So we've done. So I'm happy with the airway for now. Breathing has been relatively stabilised. Circulation, we've got fluids in. Can we catheterise the patient as well, if that's possible? And in terms of the fluids, we're going to need half dextrose, half saline. I'm going to need 2 mils per kilogram. I'm also going to need some maintenance fluids as well. So can we get a weight? Do you know what the weight is of the child? Where's the grandmother? Where's the grandmother? I can't weigh them out. Yeah. I'm very sorry. Do you know what the weight? Yeah. We're stabilising. Do you know what weight is approximately? The last time she was measured. Okay, that's fine. That's fine. Scales. Okay. That's fine. Okay. Yeah. How old is the baby at the moment? How old is the baby at the moment?
3 months.
2 months. Okay, that's fine. Okay, let's get the warmer in as well if that's possible, because it's obviously very, very high risk of hypothermia. It's a very small baby and relatively large burn. So we get this in.
Paediatric reg is on the way.
On the way. Fantastic. Okay, good.
No allergies and no current medical conditions.
Brilliant. Okay, fantastic. Thanks very much. Yeah. So we'll just get something to cover the baby for now. That's fine.
What do you need me to do?
Yes, let's get a bit of hugger as well, and let's get the fluids started. So we've kind of calculated how much we need, but I think we should probably start giving them now. So if we can have a half dex, half saline, 2 mils per kilogram over the first 24 hours. This burn has literally just happened, so we'll get the first half of that over the first 8 hours, second half over the next 16 hours. We're going to need some maintenance fluids as well at 50 mils per kilo for the first 10 kilograms. So this baby's going to be pretty light, so probably 50 mils times whatever weight they are, and that's given in the first 24 hours. Yeah, so it can be half dex, half saline. Yeah, dex saline. Yeah, so that should be hopefully in that trolley there. Not Hartman's. In fact, no, we use Hartman's for that, and then we use dex saline for the 2.6 kilograms. Great. So we get so 2 mils times 2.6 for the first 24 hours, and then dex saline.
We have an AB. We have tracing. Just play with the probe again.
Okay.
Our sats are 80.
80. Okay. Okay. Fine. So let's. Okay. So we need a Godello away now, please. Can I get a Godello away for this child? And where's the anaesthetist? Where's the pediatric anaesthetist? I need them here right now.
On his way.
Okay, fine. Right. Okay. So, okay. If we just get a bit more pressure on that head, and I need a airway adjunct of some sort, either nasopharyngeal or Goodell. Hello. All right. Yes, I'm very sorry. This is I know Shimard's wounds. This is a 2-month-old child who's been involved in a house fire. He's been involved in a skull burn in his respiratory. She was unfortunately burnt by. While she was in her grandmother's arms. She's been quite unwell since she's been with initially her saturations were very, very low when she came in. We've given her some oxygen, they came to 90, but they have dropped down again. I'm concerned that there's certainly an airway issue with this child. I think this child probably will need intubation. We had a quick look before, I couldn't see anything too obvious in there. Yeah, but
Have you, what's the size and what's the weight?
yeah, okay, that's fine. Yeah, yeah, okay.
And you want 2 mils.
We've got 6 kilos, yeah.
Yeah. The burn itself is pretty much over the chest, so I wonder whether it's because of
120 sinus tachy.
sinus tachy. Okay, so that's
Check the size of the burn injury, sorry.
yeah, that's fine. We've checked about 13-15%. Yeah. So I'm happy with the pulse rate of 120 with this child of this size at the present moment in time. So just basically, I want you to come down to see if we need to intubate this child or not. We are. I'd be slightly worried about the airway. We managed to stabilise it slightly, but I think
Not really my call, but there needs to be. You could try a nasal.
nasopharyngeal.
That's what we're waiting for.
Yeah, we've been waiting for that. Yeah. If we could help us with nasopharyngeal, I think staff are a bit uncomfortable finding one, I
So I'm
believe.
getting really worried about her, and I don't know how to tell her mum and dad about
Okay, I think if you tell the mum just to come straight in, I think.
I'm not going to be able to face her because
Okay.
it was my fault.
Oh, it's okay. Don't worry. If only,
What do I say
Chrissy,
to
if you
her?
do you mind calling the mum? Is that all right? That'd be great. Okay, that's fine. Okay, so can I see what the latest observations are at the moment in time? Are anything improved?
Yeah, you're worried about the sats, weren't you? They were
Sats 80. Okay. What are the saturations at the moment, please?
So her heart rate is jumping up and down.
Yeah.
As you can hear.
Yeah.
It's now at 60.
60. Okay, fine. Okay, so I said 60. So I need the pediatric anaesthetist. I need some.
He's coming right.
That's fine. We need to probably think about starting formal CPR for this child as well. Any luck on the pediatric registrar? Because we are. Okay.
He's right here, but the PICU is away.
PSU is okay. Fine. Okay, so we need the pediatric anaesthetist as well. Just for this child, is there anything else we should do at this moment in time?
18.9 mils. 18.9 mils is what they've worked out on this.
Oh, for the resus. Okay, fine. Right, let's start the resuscitation straight away. No delays there. We also need to catheterize the child as well. So
Back at 114.
back at 113.
You're doing it.
Okay, that's fine. So that's improving.
Dropping.
So it's dropping. Okay. So we're, yeah, that's on. Okay, that's fine. We need the bear hugger properly up as well. That's all right. So someone can plug that in.
Okay, guys, well done.
Yeah.
Well done, everybody.
Very good lead.
Tomorrow, that was excellent. Maybe we'll take comments. How did it feel?
Felt well about that. I'll be honest with you. It's difficult when you're, managing a newborn baby, and obviously the grandmother comes in, they're a bit hysterical. And the key thing is you've got to do is just to kind of.
See my hysteria.
No. I think the key thing is just to kind of, the child is a priority. So obviously what's happened has happened. We need to know as much as we can know. But I think the relatives just need to be out of the way as soon as possible, because I think they would interfere with the process. Obviously, this child was quite sick when they're coming in. I think I tried to get as many people involved as possible. Obviously, and then there's certain things I could do, but there's certain things I can't do. So I just try and prioritise, what we could do first, and kind of get things started as soon as possible, really. Yeah.
I think that was excellent. What do you think?
It's very difficult to call people because obviously I was calling, you were asking for people, I was calling people, but the child literally has just come in. So Shamari's taking the history and I'm calling people without actually knowing apart from what I can see.
Yeah.
So it's trying to relay the urgency without having the details.
Yeah.
That was really
Which
difficult.
can happen,
Yes, and so it's trying to prioritise this patient against whoever else. But it was fast-paced. I felt like it was moving on quite quickly, and all of a sudden lots of people appeared. So I almost wasn't involved centrally, more on the periphery.
Okay. That's kind of leadership behaviors that you displayed, because he was running the scenario effectively and very well, and you delegated. She received some of those, and although she was supposed to be your right hand as a nurse, she had to step out to do a lot of other things. So that is also a form of leadership, except that her leadership was putting things together. So it was communication on the other side. So there's so many categories. Your teamworking is leadership, your assertiveness, your decision making, your communication skills, your interprofessional communication. These are all like leadership facets or bits. And she did really well, but she missed out on this. Now it can happen. You could have delegated and threw that to somebody else. You could have got somebody else. But this is what happens. Sometimes you just need to pass on a message because it is urgent. Yeah. Good. Any comments?
I don't know. I was kind of just with the grandma the whole time.
Caroline, how do you think they did?
I was brilliantly handled, I think. I would have felt reassured, and I was treated with courtesy, respect, and no patronisation, which is important. And I was given enough information that would have made me feel a lot calmer. Thank you, well done.
Now, faculty, Prof, Mr. Wilson, Prof, any comment?
Well, it's a bit difficult. You get a child with a moderate-sized scalding who's got respiratory problems without any obvious involvement of the airway. So you've got to think about what else might be going on, what other comorbidities they may have. And it was a bit like Casualty. What's the other program?
Obviously.
Holby.
I don't get anyone.
Get it now. I want everybody in now. So actually, the key issue, and I think that's, you need to prioritise what the problem is and what's going to kill the child in the first instance, and that's airway and breathing, isn't it? There's obviously something funny going on there, so they need their airway controlled, either with a good airway, which came in fairly late in the scenario, we did ask for it a couple of times, or you need somebody who is capable of intubating and ventilating the child. So all that bradycardia, tachycardia, all that is probably raised to desaturation. So you need to control the airway, maintain gas exchange. So that's the key thing. And actually, forget about the burn. The burn's not going to kill the child.
Yeah, that's true. That's true.
Yeah, forget about the burn. And you need to make sure. And that's a bit unfair because I don't think you'd ever really be expected to do that in your clinical practice. You're a plastic surgeon.
Yeah.
And you go, a little one like this comes in, there'll be thousands of children's doctors milling around. But it is good. You're put in a situation where you're completely out of your depth and out of your day-to-day experience, and I thought you did very well with it.
Yeah, much.
But it is difficult. But I think with these sort of things, when you don't really know what's going on, you've got to prioritise what the key issue is, what the key clinical issue is, and what's going to kill somebody.
We were assuming rather that it was a children's hospital and the ICU and registered all the vehicles, which in Birmingham, a lot of the hospitals are not.
But there will be. Well, actually, you're right. But in a lot of hospitals, there's less and less paediatric skills available. But there should be some paediatrics. There should certainly be some airway skills available.
Yeah, there should be senior anaesthetists that could have a go. But certainly, QE.
Yeah, that's true.
We have kids from the QE and the children that were brought to the QE, and their reaction is, "Oh my God, send them to the children."
Yeah, children.
So.